The environment has to be
What we are saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be bitter about things. I'm fine with that.
Professor Ranga, Singapore plans to spend 2% of the GDP on healthcare for the elderly by 2016, and this will increase to 3.5% by 2030. May I ask how does this compare with the expenditure in other countries, and whether enough is being done in healthcare preparation?
So Singapore is actually very efficient compared to almost any other country. So you take the US, that's between 16 to 19% of GDP.
Health, not on the elderly,
No,
just on
just
healthcare.
healthcare.
Okay.
So, and if you then take it as a proportion, the majority of the money spent is the last 1 month of somebody's life. And then if you actually break it down even further, it's the last 1 week of someone's life that consumes most of the healthcare dollars. In Singapore and many Asian countries, it's much less than that. And part of the reason is people, at least so far, tend to die at home. And they're not trying to get the last few days of life extended. So one of the big initiatives, and I think Singapore has also launched it, is called Advanced Medical Directives. You actually have to put down in writing and say, these are the things that are acceptable to you, and these are the things you don't want done to you. And I'm not yet aware how well people are aware of it in Singapore, but it's a big deal in the US, and it's an issue of control. The person has to feel like they are not just somebody out there that anybody can do anything to. And the family members often will do more than you really want because they don't know your wishes. You don't want to feel guilty. And if there are many siblings, it gets quite complicated. So it's a big issue. Several things will happen in aging populations for healthcare. More number of beds, hospital beds. And I think you're seeing this in Singapore. I think it's
And are we building enough beds for 2030 and beyond?
I think they are trying to do. The big problem is going to be finding enough doctors, finding enough nurses and healthcare workers. And the doctors, how many can you train and how fast? And Singapore is doing that. It's a third school open. The second is nurses. And the big problem here is how do you get people want to be nurses? How do you get young people involved in nursing as a career?
Geriatric care.
Geriatric care is a particular thing which is even worse. Even when nurses come in, they want to work in a surgical unit or they want to work with the more exciting parts. Geriatric people, and it's the same with physicians. The number of physicians who train in geriatric care is not very high. So one of the things that the government here, plus most countries are doing, is if you actually go to the hospital, it's not filled with young people. It's filled with elderly. So whether you like it or not, physicians have to learn how to work with an elderly population. That means figuring out different ways of giving medicines, figuring out that these medicines don't work the same way as you get older. You'll have more problems. Being able to understand and prevent falls, which is a very big deal in the elderly. You fall and break a bone, especially a hip bone, it's a bad prognosis. Very hard to recover from it. You don't have the resilience as you get older to recover from events. And a lot of this is trying to get more awareness. One of the things that's happened in the US is they developed a program called Grand AIDS, AIDS. And this is to get, there are a lot of elderly who are very healthy. How do you get them engaged and be productive is to actually train some of them to provide basic health in the homes of other elderly people.
So this is the type of support services that you would have to develop to
You'll
take care
have
of the
to
elderly.
develop, yeah. And one of the things, the ageism is going to vanish, I think, because as the population ages, systems are going to change to protect the aging. And that's, if you go to Florida, you really see a population which is very old. But they do everything. They're the ones who drive the taxi, see it here too, but they're also the ones in restaurants, hotels, banking, whatever.
But my question is now the preparations that the government is doing in terms of senior activity centers, in terms of training specialists, people to help the elderly. How how is it progressing?
I think they're doing quite well in the sense that Singapore plans a lot more than most countries do. So they are doing a whole lot of things. But there are going to be, the big issue is what you point out, the support ratio. Young people, not enough to support an older population. It's a very tough problem.
And also persuading the young people to take up services to work in the elderly industry.
Yeah.